We're delighted to be working with the Southwest region, and I'm delighted by what Thrive Plymouth has been doing, and I hope what we're doing with the Southwest region will help to inform Thrive Plymouth's next decade. Let me give you a little bit of national background. The summary is that the United Kingdom is a bad place to be poor, and there's a lot of it about. What we know is that in terms of health and health inequalities, things are not good. If we look at life expectancy nationally between 2009 and 2023, a 14-year period, life expectancy did not improve at all. At all. I don't know of another 14-year period in peacetime where life expectancy in the United Kingdom did not improve. Something has gone terribly wrong. And health inequalities got bigger regionally and by level of deprivation. Health inequalities got bigger. In the introduction, you heard about healthy life expectancy. Healthy life expectancy for the poorest people got worse. It went down. Health for the poorest people in the United Kingdom is deteriorating, particularly for women spending more years in ill health. It's really a dreadful situation. The opening line of my book, The Health Gap, was why treat people and send them back to the conditions that made them sick. You've heard the new health secretary talk a great deal about a broken NHS and launching a 10-year plan to fix the NHS. Very welcome to focus on the National Health Service. But focusing on the National Health Service alone will not fix the major part of health inequalities. In Britain, lack of access to quality healthcare is not the major reason for inequalities in health. Inequalities in health are due to inequalities in the social determinants of health, the conditions in which people are born, grow, live, work, and age. When I said Britain is not a good place to be poor, if you look at gross national product per person by region in the UK and take out London, the gross national product per person goes down by about 14%. London, pretty rich. Take out the richest part, and the gross national product per person goes down by 14%. If you go to the Netherlands and take out the richest region, Amsterdam, it goes down by maybe 2%. Go to Germany, take out the richest region, around Munich, Bavaria, goes down by around 2%. Go to the United States and take out the richest region around Massachusetts and the like, it doesn't change very much. We've got this enormous concentration. If you take London out of the GDP, the gross domestic product of the UK, I said it goes down by 14%, we then become as poor as Mississippi, the poorest of the 50 United States. We're Mississippi and London. That's a dreadful situation. And our health looks like that. It's, in one sense, remarkable that we don't have even worse health than we have. And when we look at why health stopped improving and health inequalities got bigger, I can point to all sorts of things, but austerity, rolling back of the state. We published a figure recently. We looked at life expectancy for every local authority in England in 2010-12. And then we looked at the subsequent reduction in local government spending power over the next 10 years. The shorter the life expectancy in 2010-12, the steeper the reduction in local government spending power over the next decade. The sicker the community, the more money was taken away. In what moral universe could that be the right thing to do? We know that overall central government support for local government went down by 59% over the decade, but it went down in a very regressive way. The greater the need of a population, the more money was taken away. Is it a surprise that health inequalities got bigger? That healthy life expectancy for the poorest people got worse? No, I don't think it is. I think it's a direct result of political decisions. Child poverty went up. If you ask people in Britain, as the Gallup organization has done, do you think the next generation, today's children, will have a better life than you, about the same, or worse? In Britain, fewer than 1/3 of adults think that today's children will have a better life than them. What? Fewer than 1/3. A generation ago, my guess is, if you'd asked adults, will their children have a better life, they would have said yes. And they were right. They were right. There were all kinds of improvements. Now, today's adults may be correct. Their children won't have a better life than them. What have we done? What have we done? And if we look at social mobility, one way of looking at social mobility is, can today's children born into poverty get out of poverty? Because in general, we know rich parents have rich children, poor parents have poor children, middle parents have middle children. I mean, when the children become adults and earn incomes. And that social mobility, the chance of, if you're born into poverty, getting up to the middle, is lower in the UK and the United States than it is in most other European countries. Why? Because we have bigger income inequalities than most other European countries, and we don't invest in our children. The amount of money we spend on children aged 0 to 5 is way below the European average. We don't prize our children. We increase child poverty. We don't spend on children 0 to 5, and we have big inequalities about which we're doing very little. Wow, you might say, well, let's go home. This is hopeless. What are we doing here? The second most common question that I get asked is, why aren't you depressed? And the answer is, because we're working in local communities all around the country. It started in Coventry. They declared themselves a Marmot city. Then I went to Greater Manchester. Greater Manchester took it on. We did a report, Build Back Fairer in Greater Manchester, Cheshire and Merseyside, altogether fairer in Cheshire and Merseyside. Liverpool plans to launch as a Marmot city in 2025. North of Tyne Combined Authority, Northumberland, Newcastle, Leeds, Gwent in Wales. Waltham Forest and Luton, all around the country. And now the Southwest region. We've just launched a 2-year program of work in Scotland with a national strategy for Scotland and 3 Marmot places, 2 close to Glasgow and 1 in Aberdeen. It's really exciting, despite the brutal cuts to local government, despite the unpromising national context. Local areas all around the country are saying we can make a difference. It's local government, it's the health and care sector, the voluntary and community sector and faith sectors, other public institutions, police, fire and rescue service, education, business, all working together to improve the social determinants of health. To remind you, our 8 domains of recommendations were to give every child the best start in life. Number 2, education and lifelong learning. Number 3, employment and working conditions. 4, everyone should have at least the minimum income necessary for a healthy life. 5, taking a social determinant, 5, looking at the environment in which people live and work, including housing. Number 6, I was listening to your 4 behaviors, but taking a social determinants approach to healthy behaviors. Number 7, tackling racism, discrimination, and their outcomes. And number 8, pursuing environmental sustainability and health equity together. My view, based on evidence, is when we get a gathering in the room, such as we've got here in Plymouth, when we get a commitment across all the different sectors that I've mentioned to tackle these 8 Marmot principles, really, we can make a difference. Really, we will make a difference. We will reduce health inequalities and create greater health equity. Thank you.